All right, my friends, it is time to talk feminine health, and many of us really don't know where to turn. Everybody is different, so are the treatments as well. So for those struggling to find what's right for them, holistic alternatives might be the way to go. So today we are here with Deanna Seymour. Welcome.
Thank you for having me.
pH-D. Yes,
Yes.
so glad that you're here. We need to start with the mission behind this business.
Yes, well, our mission is to create products, holistic products that improve the lives of women. And that's what we've done since day one.
Okay, because you are, I do want to know, you're the only certified women-owned feminine healthcare product on the market. You've basically created a whole new category in the industry. So talk about these products.
Yeah, so I struggled with my own feminine care issues and was in the pharmaceutical industry and was really looking for a holistic alternative for feminine care, but it didn't exist. And I wanted something backed by published clinical data, and I found it in this ingredient called boric acid, and it completely changed my life. I knew I had to bring it to the market to help the millions of women like myself who needed this product too.
Because as women out there, we all know you're in a bathing suit, you take a prescription, things can
get out of whack.
Yes.
Exactly. And boric acid helps with that, and it's a holistic alternative. It's been used for over 100 years, but it just wasn't available commercially until we brought it to market.
What is it?
So it's a naturally occurring compound found in seawater, and it's been one of those old wives' tales used forever, but it actually is clinically effective and recommended by thousands of healthcare providers nationwide.
You know what I find interesting is that you were in the pharmaceutical industry prior to creating this brand.
Yeah. So I love the business of health, and I loved working every day to improve the lives of people. And this idea came to me through my own personal woes. Sometimes that happens. Necessity is the mother of invention. But to have an ingredient backed by literature and studies was very important to me, and that's what we've done.
So what have customers said? I've heard very positive things, but please explain.
Yeah, so we launched on Amazon in 2014, and within 6 months we're the bestseller in our category, which was very exciting. But the most important thing were the reviews of the women who had used the products. And they were evangelical about how pH-D, boric acid suppositories had changed their lives, because many of these women suffer with issues for decades, and it wasn't until pH-D was brought to market that they really found an effective solution to their feminine care needs.
Now you have a big event coming up with the charitable component. Please talk about it.
Yeah, so I've heard it said that really lean into issues that break your heart. And for us, what breaks our heart as a company is to learn that many women can't afford period care products. So we are partnering with the Community Foundation of Middle Tennessee, and we're having an event called Know Yourself Well, where we will celebrate womanhood. We will talk about issues that many women are afraid to discuss. We'll have our healthcare advisors there and a comedian as well, and we'll give away $150 worth of free pH-D products. But it'll be a night of gathering and intimate conversations about all things feminine care.
Because real quick before we go, what do you want our female listeners out there to know?
Yeah, that it's okay, that these issues are a fact of life. They're the #2 reason a woman will visit her doctor in her lifetime. And it's okay to have open, honest conversations about feminine care and issues that affect vaginal health.
Absolutely. Thank you so much.
Thank you.
Very, very good. To learn more, visit phdfemininehealth.com. You can also scan that QR code that's right there on your screen, and you can get 15% off the Know Yourself Well event. It's going to be so, so wonderful. Thank you.
Thank you.